Hello and welcome to Healthy Living on Trust Television, where we delve into crucial aspects of health and well-being. Today, we're discussing neonatal and infant care from a pediatrician's perspective. We'll explore comparisons with modern practices to archaic and traditional methods and hear from a pediatrician about the best ways to care for our babies from birth through infancy. Joining us today is Dr. Nwala Gabriel Chuks, a consultant pediatrician. It's a pleasure to have you with us, Doctor.
Thank you for having me, Aisha.
Now, let us start by stating it out there. Why is there the need to care for babies?
Okay, baby is just like every other individual. It's a unique set of people that have some peculiarities that requires that you tailor whatever you're doing to their individual needs. Now, a baby that comes out at term might have different set of needs when compared to those that came out earlier. So that's why whatever you're doing for a newborn, you have to tailor it to how early or how late this set of neonates came out.
Okay.
So that's why.
Now looking at some traditional practices that mothers have used for their babies over time, I'd like to hear from you. What are some of these methods and why would you consider them, or why do research consider them as posing health risk to babies?
Okay, so let me start. Let me talk about them from two different points of view. One, I'll talk about the ones that are good practices, as well as the ones that are harmful. So let me start with the ones that are good practices. One is, if when a mother takes in, it's expected that from the time a period is missed, from the second missed period, the pregnancy should be registered in the hospital, should be booked, as it were, so, and monitored from that point till the point of delivery. Reason being that there are some things that the mother might consume, from medications to some exposure to some environmental factors that may be harmful to the growing baby. So if the mother registers for antenatal care and the pregnancy monitored as it should up to 10, there will be slimmer chances of the baby coming to some harm when compared to not registering. Some people will wait until when the pregnancy is long gone before they register for antenatal. One of the problems of not registering for antenatal early enough is the fact that there are some supplements pregnant women are given, things like folic acid, that help the brain and spinal cord formation. Now, if the mother fails to register for antenatal as early as the first few months of pregnancy, by the 28th to 29th day of life, the whole brain, what we call primitive neuropause, would have closed. That means the brain and the spinal cord would have formed within this first few. We are just talking about first 3 to 4 weeks of life.
Okay.
So if these supplements are not within this period, the child might have some developmental problems like meningomyelocele and the rest of them, which means that this baby might have problem that would have started from these first few weeks or first few months of life till the child is delivered. So registering for antenatal care and seeing it through is very, very important. Another thing is that there are some medications you might take. Let's say the mother has a febrile illness in the course of the pregnancy, and they now goes to buy medications that are not safe for a pregnant woman. Those medications can actually harm the baby, and baby comes up on congenital anomalies. Another thing is, if the pregnancy is, is threatening to come out, and all the necessary provisions are not made, and this baby comes out early. Let's say baby needs neonatal care or intensive care and all that, and they are not available at the point of delivery. These babies might come out and now run into series of problems, which if care is not taken might lead to a very adverse outcome in the babies. So basically that's why babies need to be monitored appropriately from the time they are down to when
you have stated quite a number of care that even right from when the mother is pregnant, she has to really ensure that these methods and preventive measures for in case there will be an issue later after delivery. Now, my point here and our area of focus today is when a baby has been born. I mean, the first few weeks that this baby has been put to birth, we're hearing there are issues of, there is, if it's a female child, there is the case of piercing the ear. There's also sensitivity of skin. We have seen cases all over social media these days where new babies, maybe due to the process of piercing the ear, the skin on the ear, they come up with some issues. There's pulse and all of that. And then we've also heard about how some doctors would advise that you shouldn't touch babies on their faces or kiss them on their faces, more like the feet. I just want to hear about the sensitivity of babies, especially their skin, where we're asked to wash our hands, do not touch them inappropriately, just so we don't give them maybe germs or bacteria and put them at the risk of diseases.
Okay, so if I got you right, there are three things I picked out from your question. One has to do with ear piercing.
Yes.
Another one has to do with kissing of the babies. Then thirdly, bordered on touching the babies and all that.
Yes.
So what I can say from what you said now is that these babies are tender. Their immunities are quite low, and anything, some of these things can actually are potential routes of infection entering the baby. If you kiss a baby, for instance, now, there are normal germs in everybody's mouth. Everybody's buccal cavity has, germs that are resident there. That's why if you don't brush in the morning, once you open your mouth, people will just take cover, because the number of bacteria in our mouths would have multiplied over the night. So when you kiss a baby that doesn't have a very high level of immunity to withstand infection, you're invariably introducing germs to the baby. Then when it comes to piercing the ear as well, if it's done unhygienically, you are also introducing both the hand of the person doing the procedure, even the environment where the procedure is done, are potential, causes of infection for this tender baby. Then, in addition, if babies are handled without proper hand hygiene, there are germs that are resident, on our skin, especially the hands. This same hand would have been used in the convenience. This same hand would have been used to, greet people, shake people. Some people use the same hand to, clear their, if they have maybe phlegm in the air where they want to clear it. It's this same hand. This same hand touches and all that. So if you use contaminated hands to touch tender babies, those germs in those hands can actually introduce to these babies, and you now start fighting infection and trying to treat the infection in these newborn babies. And another important thing one needs to understand is that these babies don't talk. They may not explain themselves for you to know that something is wrong. If you don't prevent the infections from getting to the babies before the signs or symptoms of the infection become manifest, it would have, long gone into the system, and you might run into very serious problem.
Okay. Now, still looking at the first few weeks of birth for these babies and looking at the traditional practices that we have grown up to see our mothers and grandmothers do to these babies. Now, let us cite a couple of examples. We're seeing, say, when the placenta has been detached from the baby and the mother. Now, there are some cultures would say traditional practices vary widely across cultures, and some would say expose the belly button, that is the navel of the baby, so it can heal earlier. We've also seen cases of even coming to feeding the child. We've seen cases where children are somehow bent to feed them, more like force feeding, say they are not taking the food the way they ought to take them, and then you see mothers turning the baby upside down just so they can feed them. Also sucking of mucus from nostrils and swaddling too tightly of the baby. I just want you to tell us the health risks all of these practices may pose to the health of the baby.
Okay, so all the things you mentioned are things that can introduce infections in the baby. If the cut care is not properly done, infections can follow the stump, the umbilical stump, what you call belly button, before it falls off. Remember that was the source of nourishment for the baby. The baby was getting blood via the placenta through umbilical stump.
Yeah.
So if the umbilical stump is severed and is not properly cared for, maybe some of the things is done in our some rural areas, like use of cow dung and other very harmful things, based and the rest are used to care for that child might have what we call neonatal tetanus, which is a very, very, very bad infection that can occur in a newborn baby that the cord is not properly cared for. So, cord care should be done with spirit swab, and the place should be cleaned every 2 hours so that it stays dry and free of any potential infection. Then the other things, like if the child is not feeding well, turning the child upside down, there's what we call sudden infant death syndrome, SIDS. Now, you know that there's no bone on the anterior aspect of the trunk. So if baby is turned on the belly and the abdomen there's pressure there, the content of the stomach can come up and the child might aspirate. So if the child aspirates, the gastric content, which is a very harmful chemical, there's what we call hydrochloric acid that is in the gastric juice. And once it enters the airway, it's very, 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 very irritant. It's an irritant material that can cause serious problem for the baby. So the baby might aspirate and die from that. That's what we call cut death. So keeping baby on the turning baby over because baby is not taking enough, or we feel baby is having belly ache and all that, it's very, very harmful. It's very, very dangerous. It shouldn't be practiced. So whatever a mother is not sure of, it's better to run it by his or her doctor, to know the things that are safe and the ones that are unsafe, so that these babies don't end up in an harm's way.
Now, this brings me to my next area of concern. We have seen neonatal jaundice coming up in some of these babies, and now some traditional practices have it that you should just probably put the baby outside to sun, say early morning sun and all that. I just want to hear how safe that is and how effective it is, and at what point do you draw the line and say this is not the right thing to do, you have to take this baby to the hospital and for proper care?
Okay, in as much as I would not dismiss the fact that there are some benefits. There's what we call heliotropic, phototherapy, where filtered ultraviolet rays of the sun is used to control jaundice in a baby. That can be done in the communities, especially where the facilities are not available. That is there. I don't dispute that. However, if there is no proper monitoring, whether these other potential conditions that can cause neurotoxicity, things like prematurity, things like infection, things like anemia, things like acidosis, if there is no proper evaluation or proper monitoring to identify some of these variables that could potentially cause even low levels of jaundice to be neurotoxic, it's not safe for a common non-medical person to just be doing the exposure to the sunlight and all that. Because if you see a child that has had acute bilirubin encephalopathy from poor management of neonatal jaundice, you wouldn't want, to risk not bringing the baby to the hospital for proper evaluation. So what I would advise is that every jaundice should be seen as a pathologic jaundice, as a jaundice that can potentially cause harm to the baby's brain. So any baby that has jaundice should be taken to the hospital for a pediatrician to properly evaluate and the appropriate treatments offered. There are some jaundice that might be do anything, reassure and monitor. There are some that you have to treat with phototherapy. You place under blue or green lights. There are specific wavelengths of light that these babies, should be kept. And there's a distance between the light and the baby, between 10 and 50 cm, from the light source to the where the baby is. And there are things to do, exposing baby's body parts and protecting vital organs like the eyes and the genitals, because the light can potentially harm those parts. These are things that professionals in the hospital do. And there are some that even not take care of. Those ones you need to do what we call exchange blood transfusion. Let's say there is a ISO immunization. If the mother's blood group, for instance, is O, and the baby's own is A, B, or AB, so you actually need to monitor the degree of derangement of the jaundice, because it can be it can derange so fast within 24 hours. The levels might get to an unbearable level that you might now need to do what we call exchange transfusion. So any jaundice should be properly evaluated in the hospital and treated accordingly.
Okay, I just want to know the role of genetic influence in jaundice here. I know that the topic here is not jaundice, but we're still talking about neonatal care, and then neonatal jaundice also comes to play. We have seen cases where some mothers, their first child has jaundice, second child jaundice, third child jaundice, and then this has become more like a practice. I just want to hear from you the role of genetics in this analogy.
Okay, so I'll try to list 5 common causes of jaundice in an environment. Then I'll now try to pick out the ones that could explain the recurrence of jaundice in a family. For instance, there is what we call ABO incompatibility. It's one of the 5 commonest causes of jaundice in an environment. Now, if the mother's blood group is O and the father's own is A, B, or AB, and the baby picks up the father's blood group. Now, because the mother's blood group, being O, has the antibodies against A and B antigens, the baby, if the baby picks the father's blood group and the mother's blood seeps into the child's own, through the placenta, those antibodies will be attacking and destroying the baby's blood, the A or B or AB blood. So that's one of the causes of jaundice that can be inherited. So any of the babies that now come out with any of those blood groups can equally have jaundice. The second one is what we call rhesus immunization. If the mother is rhesus and the father is rhesus positive, and the baby now ends up being rhesus positive, there's also that risk of the same thing I explained before. the maternal serum having the antibodies against this rhesus antigen, destroying the the red blood cells of the baby's blood because of that ISO immunization. Now, for ABO, is worse. I mentioned ABO as the first factor. Is worse with the first pregnancy, but gets less with subsequent ones. While rhesus is worse with the subsequent one, it might be less with the first pregnancy, but as subsequent pregnancies, now come, the jaundice tend to be worse. The third one is what we call prematurity. Anything that comes out before 37 completed weeks, that child is at risk of jaundice. So any mother that has given birth to a baby before 9 months has the risk of having other pregnancies coming out before 9 months.
Okay.
So you can also have jaundice, recurrence of jaundice in such babies.
Okay.
The fourth one is what we call GC-PD deficiency. GC-PD deficiency, there's an enzyme, an enzymopathy, where an enzyme helps to keep the red blood cells in the reduced form. The levels are low. The baby is commoner in male babies, for instance, now. So if there's GC-PD deficiency, that male baby that has the enzyme, in the presence of stressors like infection, will have their red blood cells breaking down, and this is an inherited, a genetically inheritable condition that can lead to jaundice recurring in male baby in that in the family. So
Okay.
the last one is infection. So I won't really say infection directly is inheritable. There are some conditions that can be inherited that the children in that family will have very reduced immunity that can now lead to their babies having infections when they come out and jaundice as a result.
Yes.
There's what we call severe immunodeficiency syndrome, which those babies have inability to fight bacterial infections. So such babies with such inheritable condition can be having infection, that's inability to fight bacterial infection that might manifest as jaundice.
Okay, thank you so much, Doctor, for your insight on that. And it was quite a breakdown there. I just want to hear from you your take on the introduction of locally made herbs, and then how mothers sometimes do not introduce their children early to immunization or vaccines.
Okay. The issue, there are a lot of this. It is something that is a bit worrisome. There are a lot of children nowadays that are undergoing dialysis, peritoneal dialysis, and hemodialysis, well, because of kidney failure. Now, all these herbs now, most of the herbs don't have dosage. Most of them, don't have, the pattern, the frequency of administration. We just say, okay, fill 1 cup and give. Now, these herbs, because they are harmful, the liver needs to detoxify them so that it doesn't cause any harm to the baby. Then the kidneys will need to excrete them if the body doesn't want them. Now, because a child's body is still immature, it will struggle to handle these harmful materials like herbs. So it's something that should be discouraged. Mothers should not give their children herbs. Herbs can be harmful to an adult, not to talk of a child that the organs are still tender and developing.
Okay,
Then,
can you elaborate, say very briefly, the importance of vaccinations and regular pediatric checkups?
Okay, concerning immunization now, immunization is one important thing that should be encouraged, that helps to prevent, there's what we call vaccine preventable diseases, things like polio, things like tuberculosis, things like hepatitis, diphtheria, and the rest. Now, all these infections now, because baby lacks the ability to fight them when they come, the best way to reduce the life-threatening these life-threatening conditions when they occur, ensure that these babies get immunized against them, so that even if they are exposed to those infections now, the body will be able to handle it to some extent, because the vaccines will help to um, put some what we call memory cells that will be able to fight the germs once they enter the body, unlike a child that doesn't have any form of um, exposure to the life attenuated or the acute or the inactivated forms of the infection. So routine immunization, routine checkups should be encouraged. That will help keep our children safe and ensure that some of the resources that are channeled to taking care of them when they fall, are channeled to other productive ventures like their education, feeding and other things. Now, if you prevent infection from occurring, your child will not need to come to the hospital to be admitted for a long period of time because of one infection or the other.
Okay, Doctor, due to the want of time, I would have loved to hear more of your insights and perspectives on this particular subject, but we do hope to have you on the program again. Thank you so much, Dr. Nwala Gabriel Chuks, consultant pediatrician, for sharing your valuable insights with us today. It is clear that modern pediatric practices offer a safe and effective approach to caring for babies from birth through infancy. If you're a new parent, and it is best you practice based on modern technology. And that concludes this week's episode of the program Healthy Living on Trust Television. For comments, contributions and suggestions, do well to follow and subscribe to all Trust TV social media platforms. Download the Trust TV app on iOS and your Android devices, and also join us on our YouTube live stream. Join us next time as we continue to explore subjects crucial to your health and well-being. I'm Aisha Salihu. Thank you so much for your time.